1. Cognitive behavioral therapy, CBT, primarily focuses on which of the following principles? A. Altering unconscious drives. B. Changing maladaptive thought patterns. C. Exploring early childhood experiences. D. Reinforcing external behavior through conditioning. 2. In CBT, the process of identifying and challenging irrational beliefs is known as A. Cognitive restructuring. B. Exposure therapy. C. Behavioral activation. D. Emotional flooding. 3. Which of the following best defines automatic thoughts in CBT? A. Conscious reflections that occur during therapy. B. Deeply held moral beliefs. C. Immediate, often unconscious thoughts influencing emotions. D. Daydreams related to stress. 4. When designing CBT interventions for adults, the educator must consider A. Developmental learning styles and self-directed goals. B. Only the client's family background. C. Cultural background exclusively. D. The therapist's personal biases. 5. What is the main goal of the behavioral experiment technique in CBT? A. To test the validity of cognitive distortions. B. To reinforce negative thinking. C. To enhance memory recall. D. To suppress emotional responses. 6. A CBT educator assessing client progress should primarily evaluate emotional stability alone. B. Cognitive change and behavioral outcomes. C. Verbal communication patterns only. D. Physical health indicators. 7. Which of the following would best exemplify cognitive distortion? A. I failed once, so I'll never succeed. B. I need to try a new strategy. C. Mistakes help me improve. D. It's okay to learn slowly. 8. The Socratic questioning method in CBT aims to A. Confront the client directly. B. Encourage clients to self-examine thoughts. C. Avoid client interaction. D. Provide therapist-led instruction only. 9. In CBT curriculum development, which step is most crucial for measurable learning outcomes? A. Defining learning objectives aligned with client needs. Designing complex tests. Increasing session frequency. D. Reducing participant feedback. 10. Regulatory compliance for certified CBT professionals includes A. Adhering to ethical guidelines and client confidentiality. Sharing client data with peers. C. Disclosing case results online. D. Encouraging public testimonials. 11. The ABC model in CBT stands for A. Affect behavior consequence. B. Antecedent behavior consequence. C. Awareness belief cognition. D. Assessment behavior cognition. 12. Which of the following best describes schema in CBT? A. A deeply rooted belief system guiding perception. B. A daily behavioral checklist. C. A structured session plan. D. A form of emotional expression. 13. When mentoring a CBT trainee, the supervisor should emphasize A. Self-awareness and evidence-based interventions. B. Personal opinions. C. Non-structured therapeutic methods. D. Emotional detachment. 14. In adult CBT learning environments, self-reflection enhances A. Client dependency. B. Internal motivation and insight. C. Therapist dominance. D. Session control. 15. A major ethical principle in CBT education and practice involves A. Maintaining professional boundaries and informed consent. B. Ignoring emotional responses. Promising guaranteed outcomes. D. Using unverified methods. 16. The behavioral activation technique is most effective for A. Clients with depressive symptoms. Clients with insomnia. C. Clients with phobias. D. Clients with memory issues. 17. When evaluating CBT outcomes, which metric is most reliable? A. Reduction in maladaptive behaviors. B. Number of therapy sessions. C. Therapist satisfaction. D. Peer review feedback. 18. In developing CBT materials for adults, an instructor should focus on A. Problem-centered rather than content-centered learning. B. Memorization of theory. C. Instructor-led lectures only. D. Abstract reasoning. 19. A key component of CBT that differentiates it from other therapies is A. Focus on the interaction between thoughts, feelings, and behaviors. B. Exclusive analysis of childhood experiences. C. Reliance on dream interpretation. D. Dependence on psychoanalytic tools. 20. A CBT practitioner ensures evaluation validity by A. Using standardized assessment tools. Creating untested quizzes. C. Allowing subjective ratings. D. Ignoring data trends. 21. The downward arrow technique helps a client to A. Uncover core beliefs driving surface thoughts. Reduce emotional intensity directly. Avoid self-analysis. D. Build positive affirmations only. 22. When mentoring CBT students, formative evaluation helps A. Improve learning during the process. B. Judge performance after the course only. Replace summative tests. D. Eliminate client feedback. 23. The purpose of a relapse prevention plan in CBT is to A. Anticipate and manage potential setbacks. B. Focus on short-term symptom relief only. C. Depends solely on medication. D. Encourage avoidance behaviors. 24. In CBT communication, reflective listening is used to A. Show empathy and clarify understanding. B. Challenge without validation. C. Shift focus to the therapist's view. D. Speed up the session. 25. Which principle best aligns with adult learning theory and CBT training? Adults prefer self-directed and goal-oriented learning. B. Adults rely solely on instructor authority. C. Adults avoid self-evaluation. D. Adults learn best through passive observation. 26. A common error in CBT evaluation is A. Ignoring the client's self-report measures. B. Integrating both qualitative and quantitative data. C. Documenting client progress. D. Tracking emotional regulation. 27. In CBT supervision, modeling desired behavior means A. Demonstrating appropriate therapeutic techniques. B. Giving directives without explanation. C. Limiting role-play sessions. D. Ignoring mentee input. 28. The CBT technique thought record is primarily used for A. Tracking and analyzing patterns of thinking. B. Recording session attendance. C. Measuring medication effectiveness. D. Documenting physical health progress. 29. The purpose of psychoeducation in CBT is to A. Help clients understand how thoughts influence behavior. B. Diagnose mental illness. C. Replace therapy sessions. D. Focus on medication management. 30. When teaching CBT ethics, instructors should focus on A. Confidentiality, dual relationships, and competence. B. Therapist personal values. C. Client dependence. D. Minimizing supervision. 31. Which of the following best reflects collaborative empiricism in CBT? A. Therapist and client test beliefs together. B. Therapist dominates the analysis. C. Client follows instructions passively. D. Therapist avoids challenging thoughts. 32. In CBT curriculum design, evaluation alignment ensures that A. Assessments measure the intended learning outcomes. B. Objectives are optional. C. Testing is subjective. D. Learning is unstructured. 33. The ultimate goal of CBT education and practice is to A. Empower clients to self-regulate thoughts and behaviors. B. Depend on therapist input. Focus on theoretical debates. D. Avoid emotional processing. 34. In cognitive behavioral therapy, what is the main purpose of a functional analysis? A. To identify the relationship between thoughts, emotions, and behaviors. B. To diagnose a client's medical condition. C. To test memory retention. D. To evaluate emotional intelligence. 35. Which of the following best describes behavioral rehearsal in CBT? A. Practicing new skills in a safe environment before real-life application. B. Repeating old behaviors until mastery. C. Reviewing theoretical material only. D. Avoiding confrontation during therapy. 36. When designing CBT training for adult learners, instructors should prioritize A. Experiential learning and case-based application. B. Memorization of research studies. C. Instructor-centered lectures. D. Rigid testing without feedback. 37. What is the purpose of graded exposure in CBT? A. To help clients confront fears in small, manageable steps. B. To suppress emotional responses completely. C. To ignore anxiety triggers. D. To analyze subconscious motives. 38. Which of the following statements about CBT evaluation is most accurate? A. It should be continuous and outcome-focused throughout the treatment process. B. It should only occur at the end of therapy. C. It should rely solely on therapist judgment. D. It should be unstructured and optional. 39. In mentoring CBT interns, feedback is most effective when it is A. Specific, timely, and constructive. B. General and delayed. C. Critical without solutions. D. Based only on personal opinion.